Assalamualaikum to Dr. Muhammad Hakam bin Nazir. We are from Group 8, L1T2, will present result of our study. The test given is to research disease related to body system. We have selected heart attack disease in this study because in the current season, too many people suffer from the disease regardless of age, young or old. Before we start, let me introduce our group member. First is Nur Farah Aini binti Harmizi. Second is Nur Farisha binti Bedumang, which is me. Siti Khadijah binti Abdul Rashid. Nur Kristina binti Rosman. Raja Nur Adela binti Raja Ahmad Nazri. Hartini binti Soni. Husna Shakira binti Muhammad Nur.
Introduction. As has been learned, anatomy means the study of structure related to the human body, while physical is the study of the function of body part. Through this study, we have choice to study heart attack disease, known as myocardial infarctions. These diseases occur due to reduced or imperfect blood flow to the heart. This condition causes a blockage through the accumulation of fat, cholesterol, and other substances in the arteries of the heart coronary. Cholesterol-containing deposits are called plaque. The process of plaque formation is called atherosclerosis. Heart attacks are often caused by atherosclerosis fat building up in the arteries that carry it blood to the heart muscle. Knowing plaque formation in the arteries makes it hard for blood to flow. If the plaque on the heart artery break open, a blood clot from the clot then block blood flow. When it completely stop the blood flow to the part heart muscle. A heart attack occurs. Then part of the heart muscle supplied by the arteries begin to die. The damage increases the longer the arteries is blocked. In some cases, it may die. When the musical die, that is the result is means heart damage. The amount of the damage to the heart musical depends on the size of the area supplied by the block, entry and the time between injury and treatment. If it's blocked, the artery should be opened as soon as possible to reduce heart damage. In addition, the heart attack disease has several different systems for humans. The system that occur may be mild, severe, or not system at all. System the most common heart attack in men and women is chest pains or discomfort. The heart usually involves discomfort in the middle or left side chest side. Discomfort usually lingers for more than a few minutes or disappears and back. It can feel like visual squeezings, fullness, or pain. It can be taste good to such as heartburn or indigestions. Secondly, upper body discomfort. Human may be feel pain or discomfort in one or both arm, back, shoulder, neck, jaw, or upper body, stomach, or blue to the navel. Thirdly, shortness of breath. They may only be persistent or they may occur before or together with cheek pains or discomfort. It can happen when human rest or do little physical activity. Therefore, the above statement clearly show the women are more likely to suffer for these diseases.
Next, I will continue for this part, the heart function section. The heart is the most important organ in the human body. It plays a large role in ensuring that the human body continues to function properly. If there is damage to this organ, it will affect many parts of the human body. Follow to know the function of the heart that we need to know. Before going to the function of the heart, it is also good that we briefly review the structure of the heart. The first size organ is located on the left side of the chest. The function of this organ is to pump blood, touch out the body. To carry out this function, it is equipped with a muscle that is strong and durable because the heart works 24 hours a day without stopping. The pump blood contains oxygen and nutrients needed by cells touch out the body without a heart, cell will not be able to live and carry out the function. Apart from giving, the blood also carry carbon dioxide and toxic substance from the cell envelope and is carried to other organ for this purpose for detoxification. Simply put, the blood pumped by the heart causes touch to coagulation, pulmonary and systemic coagulation. For pulmonary coagulation, blood contain high carbon dioxide from the cell of the body enters the right side of the heart. Right atrium touch the superior vena cava (IVC) and inferior vena cava (IVC). Blood is then pumped by the right ventricle out of the heart to the lung via the pulmonary artery. In the lungs, carbon dioxide is removed, thus respiration and oxygen is taken up by the blood. Then blood enters the left side of the heart, left atrium, touch the pulmonary veins. Next, for systemic coagulation. After being full of oxygen, the blood is pumped by the left ventricle to the rest of the body, touch this aorta and this branch to supplies oxygen. When it reaches the cell of the body, oxygen will be taken up by the cell and carbon dioxide will be released into the blood to be taken back to the lung. That's how its size is small. The role it plays is very big for our body.
Assalamualaikum and hi. My name is Siti Khadijah binti Abdul Rashid. My metric number is H22A1161. Now I am presenting about how does the heart attack happen. The disease happens because of a coronary heart disease, CHD. It is because of heart attack. Heart attack occur due to narrow or blocked blood vessels due to the accumulation of the cholesterol, plaque, fat, and other substance in the artery of the heart. So, the blood supply to the heart is insufficient. In addition, plaque can break and form clots for the lump that blockade blood flow. This process is also known as atherosclerosis. Lack of the blood can cause a damage and destroy the integrity of the heart muscle. The heart attack is an acute event in which the vital blood supply to our heart muscle is insufficient, cause a damage to those muscle cells. The heart muscle to the myocardium receives its blood supply through the vessel holding the coronary artery. A narrowing or the blocking somewhere in the one or the more coronary artery blockade or cut off the blood flow to the heart muscle, resulting in the area of the cell damage or death. We call it a heart attack. There are three main of coronary artery that branch off the supply each part of the heart muscle with the oxygen-rich blood. Each artery supply a different area the heart muscle, so the different part of the heart can be damaged. The heart attack is easily but not always completed by a chest pain that may radiate to the neck, jaw, or lung or left arm, and the shortness of the breath. Some people experience heart pain in a different way, so the diagnosis diagnosis is based of the several different character and the test is and the test. Ischemia is a condition where the oxygen in the blood vessel are limited or reduced in the body. Cardiac ischemia is a disease in the oxygen and blood flow to the heart muscle. When the damage and death of the part of the heart muscle occur due to the ischemia or the another also name is a myocardial infarction MI. The next slide is mechanism of the blood circulate through the heart. The vena cava carrying the oxygen blood from the rest of the body to the right atrium. When filled with the blood, the right atrial wall will be contract and push the blood through the crescipate valve into the right ventricle. When the right ventricle is filled with the blood, the wall will be sucked and push the blockade through the circuit valve to the pulmonary artery and direct to the lung. For the gas exchange take place in the lung, carbon dioxide will be exhaling and the oxygen will be absorbed into the blood. Oxygen blood will flow from the lung into the left atrium through the pulmonary veins. The wall of the left atrium contract and push the blood through the bicuspid valve into the left ventricle. The left ventricle is filled with the blood. The wall will be contract and push the blood through the valve to the aorta. And lastly, aorta, the carrying oxygen blood to the rest of the body. Okay, that's all for me. Thank you and will be the next slide. Thank you.
So, um, other than that, this is about the disease happen. When this disease happen, first, the most likely to have a heart attack usually a man age 45 older and woman age 55 and older than a younger man and woman. Even though nowadays 1 in 5 heart attack patients are younger than 40 years of age. Here's another troubling fact to highlight the problem. Having a heart attack in your 20s or early 30s is more common. Between the years 2000 until 2016, the heart attack rate increased by 2% every year in this young age group. Other than that, this disease could happen to the pregnant woman. More than 75 of pregnancy-associated heart attacks are in women 30 and older. Heart disease has become leading cause of death during and after pregnancy. For example, people with lower incomes have higher rates of smoking. This is for travel to poor.
But after accounting for such factors, extra unexplained risk remains. Researchers have proposed that the body's stress response may link poverty with disease risk. In addition, heart disease is difficult enough when it strikes adults, but it can be especially tragic in children. Many different types of heart problems can affect the heart, and even the heart disease acquired later in childhood due to illness or genetic syndromes. Furthermore, congenital heart disease, we have to know that is CHD, for example, is a type of heart disease that children are born with, usually caused by heart defects that are preserved, um, present at birth. For example, in the US, an estimated percent of babies born each year have CHD. All right. Next is pregnancy as volume increases. Congestive heart failure can worsen. Congenital heart defect is you were born with a heart problem. Your baby has a greater risk of developing some type of heart defect too. You might also be at risk for heart problems occurring during pregnancy and premature birth. Other than that is um, uh, after that, many of the conditions and behaviors that put people at risk of for heart disease are appearing at younger age. One of that is high blood pressure. Millions of Americans of all ages have high blood pressure, including millions of people in their 40s and 50s. About half of people with high blood pressure don't have it under control. Having uncontrolled high blood pressure is one of the biggest risks of heart disease and other harmful conditions such as stroke. Next is high cholesterol. High cholesterol can increase the risk of heart disease. Having diabetes and or obesity, smoking, eating unhealthy foods, and not getting enough physical activity can all contribute to unhealthy cholesterol levels. Um, it's like what I said before. Before this is smoking. More than 35 million US adults are current smokers, and thousands of young people start smoking each day. Smoking damages the blood vessels and can cause heart disease. Furthermore, other conditions and behaviors that affect your risk for heart disease include obesity. Carrying extra weight puts stress on the heart. More than 1 in 3 Americans and nearly 1 in 6 children and adolescents aged 2 to 19 have obesity. Diabetes causes sugar to build up in the blood. This can damage blood vessels and nerves that help control the heart muscle. More than 1 in 10 people in the United States have diabetes. Physical inactivity. Staying physically active helps keep the heart and blood vessels healthy. Only 1 in 4 adults meet the physical activity guidelines of getting 150 minutes of moderate intensity activity per week. So I think that's just that for this is happen, and when does it happen to young, old, pregnant women and travel to
Assalamualaikum and hello. My name is Nur Kistina Binti Rosman. My matric number is H22A1226. There are 5 ways to prevent the heart attack. Firstly, reduce the consumption of alcoholic beverage. Second, get enough sleep, maintain weight, eating a balanced and healthy diet, and lastly, do not smoke or use tobacco. Firstly, I'm gonna explain about reduce the consumption of alcoholic beverage. Drinking too much alcohol can increase increase blood pressure, stroke, cancer, and other disease. It can produce an irregular heartbeat. Excessive alcohol consumption also contributes to obesity, alcoholism, suicide, and accidents. If you still want to drink, limit your alcohol consumption to no more than two drinks a day for men and no more than one drink a day for women. Next, get enough sleep. Make sleep a priority in your life because most people need at least 7 hours of sleep every night. Set a sleep schedule and stick to it by going to bed and waking up at the same time every day. Make sure your bedroom is dark and quiet so it's easier to fall asleep. Those who do not sleep enough are not only at risk of heart disease but also suffer from obesity, high blood, high blood pressure, diabetes, and depression. Maintain weight. Make sure your weight does not reach the level of obesity by exercising regularly. Regular daily physical activity can reduce the risk of heart disease and can help control your weight. By doing regular exercise, it also reduces the chance of getting other diseases that can put stress on the heart, such as high blood pressure, high cholesterol, and type 2 diabetes. It is recommended to do moderate intensity exercise such as cycling, walking, gardening, cleaning the house, climb the stairs, and walk the dog every week. There is no need to do heavy exercise to prevent heart attacks. Then, eating a balanced and healthy diet. Do not eat foods that contain excess fat. Increase the intake of vegetables, fruits, legumes, meat, lean fish, low fat and fat free dairy foods, whole grains, and healthy fats such as olive oil in your daily diet in balanced quantities. Avoid eating foods that have artificial flavorings and colorings. Lastly, do not smoke or use tobacco. Chemicals in tobacco can damage the heart and blood vessels. Cigarette smoke reduces oxygen in the blood, which increases blood pressure and heart rate because the heart has to work harder to supply enough oxygen to the body and brain. This means that even if you are not a smoker, make sure you avoid secondhand smoke. The risk of heart disease begins to decrease as early as a day after quitting. After a year without smoking, the risk of heart disease drops to about half that of a smoker.
Overall, the heart is an important organ for human survival. So, this condition causes us to need to take care of heart health in order to avoid various disease disorders that can make health disturbed. For example, heart attack disease. The most likely to have a heart attack usually a man aged 45 older and woman aged 55 and older than a younger man and woman. Heart attack can lead to death. After a heart attack, quick treatment will be needed to open the blocked artery and lessen the damage. The best time to treat a heart attack is within 1 or 2 hours after symptoms begin. Waiting longer means more damage to the heart and a lower chance of survival. One of the best things we can do for our heart is to get enough sleep. That's all from me. Thank you.